Dear friends, welcome back. Once again, I'm your teacher, Ashok Rajguru. And in this video, we are going to learn about a concept that is very important in homeopathy, and that is understanding relationships between remedies. Each remedy does not work in isolation, and in any disturbance of the vital force, every disease will manifest itself in certain stages or a sequence of symptoms. So for each stage, we shall require a different remedy. So it's very important to understand the process and the pathophysiology of disease, and at the same time also understand the relationships between different remedies. This is the first remedy we are studying, so therefore please pay attention to these concepts, and we shall be developing further on these concepts. But remember, this applies to all the remedies that you're going to study in this course later. So it's relationships that matter most when it comes to selecting a sequence of remedies, which you will always find necessary in your practice. Now, relationships in homeopathy are generally described in 4 or 5 ways, and these are the terms that you'll be coming across. We'll be talking about two remedies or more than two remedies as being complementary to each other, or the fact that some remedies follow other remedies better. That means a particular remedy is followed well by another remedy. Some remedies are inimical to each other. Some remedies will antidote the action of a previous remedy. And other remedies are often described as being collateral to the first remedy or a subsequent remedy. We shall explore these terms in greater detail in the following slide. We shall now take a look at what these terms mean in the context of our remedies. These are the 5 terms that we used. A complementary remedy is that which will continue or complete the action of the remedy that has been first chosen. We'll see more examples as we progress with the course. But for example, suppuration, if you have boils, or if a boil is about to form or an abscess is about to form, then there is a particular sequence of remedies that we shall be using at different stages of the progress of the pathology. Another relationship is that which follows well. So these are remedies that have been found to be particularly useful for second prescriptions. What we mean by second prescription is that you have chosen one particular remedy because it seems to meet all the characteristic symptoms of the case, but it has not worked. So then we pick on a remedy which is the second prescription. So these relationships, wherever it mentions follows well, it means that if the first remedy has not worked well, then you could well take a look at these remedies which have been clubbed together as those remedies which follow well. Inimical remedies are quite the opposite. They do not follow well, nor do they precede well. In the later part of the course, as we progress, you will be using some tools in order to determine which remedies fit best. Inimical remedies are a very good hint at which remedies may not follow or proceed well in case the first remedy has not worked well. I'll be giving you examples of these in every single remedy. So you'll be able to get the hang of this concept very clearly very soon. Antidote is not what we understand in our common language. An antidote normally is a term that we use in case of poisons. For instance, it will antidote the poisonous effects. In homeopathy, the concept is a bit wider. It actually corrects undesirable effects of the remedy while retaining the desirable effects. So supposing there's a remedy which you have prescribed and it is supposed to cover 10 symptoms, but it has actually given or shown improvement in 4 or 5 and it has made others worse or not touch them at all, then in case you are using an antidote, it is going to correct the undesirable effects while retaining the good effects. It will not antidote or erase the good effects of the first remedy. The last category or term that we used was collateral remedies. Collaterals are those which run parallel to the first remedy. They are very close in their uh, portrait of symptoms, and you will have to read a bit deeper, delve a bit deeper at this stage of your understanding to find out which could probably work as well or better than the remedy that you have selected. Once again, all these concepts will be best understood with examples, which we shall be examining by and by. In the next slide, we'll discuss some examples to give you a fair idea as to what we are talking about. Taking the examples of these 5 terms, if we look at complementary remedies, then with Aconite, here are a few remedies which are considered complementary. The list is quite long. I'm just taking the names of those remedies which you will be studying in the initial parts of your course. So I'll keep referring back to them as we progress. So arnica, belladonna, bryonia and spongia, they are complementary remedies. Of course, complementary in the sense that these remedies must obviously cover the symptomatology that is being presented by the patient. Some examples of those remedies that follow Aconite well, once again it's arsenic, belladonna, ferrum phos, heparsulf and spongia. Now you will notice here that belladonna has been written in capitals. That means it has got a higher association. If it is in plain print or plain font, then it has got a lower value. Those in italics are of a higher value, and those which are in capitals are of greater value. So there's more emphasis on belladonna, slightly less emphasis on ferrum, more emphasis on heparsulf, and as you can see, arsenicum and spongia are in plain font. Some examples of remedies which are inimical to Aconite. Here we have acetic acid, one example. Antidote, acetic acid in bold, belladonna and sulfur. In other words, if a person has been given Aconite and it has created certain symptoms of the remedy which are unsuitable, then belladonna or sulfur or acetic acid, depending on the complete picture, might be used to antidote those effects while retaining the good effects of the remedy. Once again, as I said, examples with cases as we progress in the course will explain this further and deeper, and I'll be taking this up in every single remedy that we talk about. Collaterals, one example which follows, which is a collateral of Aconite, is hypersulfuricum. Another thing one must understand is that each remedy has got a certain duration of action. You'll understand this concept as we progress further, but this is of particular use when we think of a remedy, whether it's going to have a long-term effect or a short-term effect. Aconite, as we saw, was a remedy that works best when the symptoms are of a sudden onset. So Aconite essentially is a short-term remedy. We'll be also looking at belladonna, chamomilla, the 3 ABC remedies, which will be the first 3 remedies that you'll study. And then we'll be looking at arnica, bryonia, and cantharis. So Aconite, as we said, is for sudden onset, and the duration of action is short, between 6 hours to 48 hours. Belladonna is also a short-acting, fast-acting remedy, and the duration of action is between 1 to 7 days, a little more than Aconite. Chamomilla, 20 to 30 days. Arnica, 6 to 10 days. Bryonia, from a week to 3 weeks, 7 days to 21 days. And cantharis is a remedy which is said to act between 30 to 40 days. Now, once again, I must remind you that these are only very general rules, and they are a guiding light to individualize a remedy. Every person will not react to Aconite or will not have a duration of action of only 6 hours. It could be even further. But these are just guidelines, and they can also be helpful Depending on the state of health and the strength of the life force, we can expect results by keeping these numbers in mind. Once again, practice makes perfect. We'll be looking at this by and by. Another important thing for a homeopath is to advise the patient about lifestyle guidance. And one of the important things in lifestyle guidance is guidance regarding food and drink. Sadly, this point is often missed. And one of the reasons why it is missed is that people do not know where to find the information. I'll be including this in virtually every remedy that we shall study in this course. As far as Aconite goes, you can keep this in mind that the remedies shown on the left with a plus sign and in green are those which will help, and those in red, which are shown on the right hand side under the minus sign, are those which a person should avoid. So one should encourage drinking milk, unless of course the person has got some milk allergies. And those which need to be avoided are acidic foods, that means sour foods, sour pickles, coffee, and wine, both red and white wine. So these are certain guidelines, and over the course of time you'll be studying more about this in each remedy. Once you have understood the concept of the remedies that follow well or complementary remedies, this knowledge had been used by many famous classical homeopaths, starting with Samuel Hahnemann himself, and two other big names that come to our mind is Dr. Eugene Nash, E.B. Nash, and John Clark. So they were very successful practitioners, and they have written tremendous volumes on therapeutics. They are extremely good guidance for therapeutics, Nash and Clark, and they often used what was known as trios or quartets, a series or a set of 3 or 4 remedies that would follow each other. As an exercise, you could look at these remedies once you have studied the others and try to understand the logic behind trios. I shall take up this topic later also. One particular trio is Aconite, followed by Belladonna, followed by Ferrum Phos. And this was particularly recommended for fevers of infancy. So Aconite would be at the very first stage, and you can't use Aconite very late in the treatment. That is followed by Belladonna and then followed by Ferrum Phos. We'll be considering these 3 remedies. Those of you who have done the course on biochemical remedies will recall the action of Ferrum Phos. Aconite followed by arsenicum followed by Roostox. This is a trio that is for restlessness. So any kind of a disease or illness where a person is feeling very restless, once again Aconite in the very initial stages, followed by arsenicum and then Roostox. At this particular stage, don't indulge in any prescriptions, but just keep this in mind, as this shall form one way of looking at remedies, relationships, and therapeutics. Yet another one is Aconite, Chamomilla, and Coffea. This particular trio is for pain relief, because the character of pain is going to change as the disease passes through its different stages of manifestation. Yet another example, Aconite, Camphor, and Gelsemium. This is for the first stages of simple rhinitis. I'm not covering therapeutics at this particular stage, but we shall be doing so, and it will be a good idea to make a mark in your notes so that you can perhaps refer back to these slides. Then there are some special remarks which I shall be adding with each remedy, and these apply to Aconite. We have been told by masters that seldom is a second dose required when it comes to Aconite, because we have seen Aconite is a very short acting and a quick acting remedy, and it's best when it is used in the very initial stages. So seldom is a second dose required. It is not indicated in malaria or low fevers. It can harm in the hypertrophy from valvular disease of the heart. Please keep that in mind. It's not that homeopathic remedies don't cause harm. Wrongly chosen remedies or the inappropriate dose or potency can cause aggravations. It is most useful in the insomnia or restlessness in any stage of typhoid. In the previous slide, we have seen restlessness remedies. So once again, it is most useful. Aconite is most useful in insomnia or restlessness in any stage of typhoid. Any stage, not just the beginning, but any stage. This is quite an exception because otherwise we normally use aconite only in the initial stages. Here it says insomnia or restlessness in any stage of, if it is typhoid. That brings us to the end of this particular lesson, and I shall just summarize the points. We saw the terms that are used to describe relationships, and we'll be using them very frequently as we progress with our study of remedies. Then we looked at the duration of action of these remedies and what they mean. Then we talked about the importance of giving advice regarding food and drink which is compatible with the remedy that you have selected. Also, we saw that some masters, including Hahnemann and of course John Clark and Nash, they had developed some quick formulas, if you want to call them. They were known as trios. And when I say trios, it is not that these three remedies are mixed together. They are taken in a sequence, one single remedy at a time. Also, we saw some special considerations illustrative of the remedy that is under study, which is aconite. So thank you very much for your attention, and that brings us to the end of this important lesson. You'll need to refer back to this in order to understand the terminology, and we shall be using this in every single remedy study. So thank you very much and bye-bye, and please put up your questions, your suggestions, your observations and comments on the discussion forum.